Think about your favorite movie. Take a picture of the first scene, take a picture of the middle scene, take a picture of the last scene. Do you think you can get all the ups and downs of the movie by these 3 snapshots? If your life was dependent on you understanding this movie, do you think you can make life or death decisions based on these 3 snapshots? A BGM, which is a finger stick, gives you a snapshot of your glucose, 1 moment in time. A continuous glucose monitor, CGM, gives you the whole story. It takes 288 snapshots throughout the day of your glucose. It tells you where you've been, it tells you where you're going, and how fast you're going. You understand the trajectory of your glucose. People with type 1 diabetes have to think about their insulin requirements whenever they eat, whenever they exercise, whenever they sleep, whenever they get stressed. They have to take insulin from outside because type 1 diabetes is an autoimmune disease in which your body kills your insulin-producing cells. People with type 1 diabetes have to inject insulin, a drug that could kill you, multiple times a day, every day, without the benefit of a doctor. And if they do it right 60% of the time, they're doing amazing. How do they decide how much insulin to dose? They use a finger stick and a blood glucose meter snapshot of their glucose, or a continuous glucose monitor, a movie of their glucose. 10 years ago, CGMs were not that good. They were not accurate. You couldn't rely on your CGM to dose insulin, and you had to calibrate it with these 2 devices multiple times a day. They were not user-friendly. You had to carry this receiver at all times to see your glucose numbers. So you're wearing this, you're doing finger sticks 4 to 8 times a day, you're carrying all of this and the receiver. Great. Innovation was slow, but Helmsley saw the potential in this technology. Remember our hallmarks? One of them is embrace a sense of urgency, innovation, and informed risk-taking. And we did exactly that. Helmsley invested $16 million over 3 major device companies, and one of them, Dexcom, came out with Gen 6, the product that we invested in, and brought it to the people with type 1 diabetes in the summer of 2018. That product set the gold standard for CGM. Finger sticks, gone. Receiver, gone. You can just trust your device, and you can see your glucose on your phone, and people can follow you. Imagine you're a parent with a child with type 1 diabetes. Your child is at school, you're at work, and you can watch their glucose through your phone. Number 1 fear of people with type 1 diabetes and their caregivers is hypoglycemia. Hypoglycemia is low blood glucose, which could lead to death if untreated. Many parents wake up multiple times a night to check their children's blood sugar with the finger sticks. With a CGM, you could be sleeping. If you're a parent, you could be sleeping on your bedside with a phone, and the CGM on your child would send an alarm on your phone and wake you up if he's predicted to have hypoglycemia. There's one more benefit to Gen 6. We invested $4 million into this project and received $6 million in royalties. And we already put that money back into type 1 diabetes research to continue to push the field forward. Remember, CGM gives you the whole story. 10 years ago, the technology was not good enough. It wasn't reliable, it wasn't user-friendly. That's why we invested in it. Today, now that we have the gold standard, the next step is awareness.
I want to start by showing you all a video of an awareness campaign that you may have heard about or even participated in.
Okay, I challenge Kyle, Gaz, Cheech, and Chum. Taste it, suckers! Go out and spray!
Who can tell me what that campaign was? Yes. So the ALS Ice Bucket Challenge, that happened several years ago, and you still remember it today. This is exactly the level of awareness that we're trying to generate for CGM. Because awareness is the first step to adoption. If people don't know what CGM is, how it works, or what products to available, how are they going to use it? As a program, we want to make sure that people are able to make an informed decision about whether to use or not use a CGM. But lack of awareness should not be the reason that someone is not using a CGM. We know that CGM improves outcomes for people with diabetes, so it can help reduce hospitalizations. Denise talked about hypoglycemia. It can help prevent these hypoglycemic events, but it's not used by the masses. Why? There are a few factors that are contributing to this. So one is, right now you need a prescription to get a CGM in the US. 90% of prescriptions are written by endocrinologists who are diabetes specialists. But what you might not know is that there's an endocrinologist shortage in the US. So we actually believe that most people, especially adults with type 1, are actually seen in primary care. Now, when you think of your primary care providers, they're treating a whole host of conditions, and they see hundreds of patients. And of these, only 3 or 4 might have type 1 diabetes, and that's at best. So staying up to date on the latest technology or best practices in type 1 diabetes care is not a priority for primary care providers. The bottom line is that physicians, they hold the key to getting a CGM. They write a prescription. But if the majority of physicians who are treating people with type 1 don't know about CGM, how are they going to prescribe it? Our program saw this barrier, and so we decided that the best way to try and raise awareness and increase adoption of CGM is to reach patients directly through a large-scale consumer awareness campaign. We started with some market research where we surveyed about 300 people with type 1 diabetes, and we asked them what kind of healthcare provider they saw. We asked them about their care management. And we went into the survey thinking that we would likely take 2 approaches based on whether someone was seen in primary care or specialty care. But the main finding that the survey showed us was not based on care setting. It was based on how plugged in a person is to the diabetes community. And when I say plugged in, I mean they're involved with or receive information from 3 or more groups. So you see here, these are plugged in, and they trust a variety of information sources, relatively the same, ranging from their doctor to diabetes bloggers. But people who aren't plugged in overwhelmingly trust their doctor. So this finding gave us 2 important insights. One is we need different approaches to reach these 2 groups. And the second is we actually need to include doctors as a target audience in our campaign. And remember, we were originally going to exclude them. So what we did next was we developed a website called Diabetes Wise, which is an unbranded, unbiased resource that uses patient stories to help people decide if CGM is right for them. So I'll give you an example of one of the patient stories. This is Chelsea. Every story asks the person why they decided to use the technology. In this case, it's CGM. And Chelsea says, so she's a dance teacher. Stopping my teaching to go check my blood sugar was a distraction distraction to me and my students. It's much more convenient to be teaching, take a look at my watch, realize I'm fine, or do something about it if I'm not. We're also trying right now to work on different approaches to reach the plugged in and not plugged in groups and try and drive them to diabetes wise. We're also trying to figure out how do we reach doctors so that they can carry our message about CGM awareness. Because awareness is the first step to adoption. So if you know someone with diabetes, ask them about CGM, and if they don't know about it, suggest that they go to Diabetes Wise to take the next step to adoption.
So when you're looking to get a new technology for your home, a phone, a TV, a computer, one of the places you can go is Best Buy. Now for many, say they want a new smart TV, they go in, they know exactly what they want, they bring it home, set it up, it's all good. But for others, they need a little more help. They might not know what options work for them. They might bring it home and not know how to hook up to the wireless, or something else happens, they don't know how to troubleshoot. Best Buy offers a service for those people. Anybody name it? Geek Squad. We want to bring the Geek Squad idea to diabetes care. The Geek Squad will be a personalized, hands-on approach to diabetes care that can scale. And the first technology we're going to use, test out, is CGM. Now we're piloting this study right now, and one of the key parts to it is the coach who will be with you the entire process, onboarding you onto CGM and then supporting you. This coach is a certified diabetes educator. So how's it going to work? First, we'll write the prescription for you. The coach will then reach out to say, here's your options for CGM, and figure out which one works for you, fits into your life. They will then send it to your house. This is all virtual. There's no going to the clinic, doctor, pharmacist, none of that. And then once it gets there, they will have a virtual call with you. How do you put it on? How do you download the app? How do you start looking at your data? And then they'll move over to support. They'll work with you over the weeks and months to start looking at the data with you to see how your behavior changes. Things like Denise said, like meals, exercise, stress, sleep, how your glucose levels change with those things, because now you'll have the data in front of you, and they'll help inform decisions to make it better. We have a couple examples. I'll tell you about Michelle. Michelle is one of the people who's probably more plugged in, like Laurel was talking about. She was very excited to do this project. She actually did her own research, knew exactly she wanted the Dexcom Gen 6. That was the best thing out there. Well, after she onboarded and put it on, before the first call she had with her coach, she started making changes herself. She wasn't waiting. She was looking at her data and started noting that little different things throughout her life could affect her glucose and actually make the numbers better. She likes to run, and she saw that if she did a little extra exercise around a meal, her numbers didn't go up as high, out of range, they stayed in target. She also saw little things with salad dressing, like the salad dressing, swapping that out, could affect her numbers. These are things that she may have done in the past, but without that CGM data, she never would have saw the results. In that first call with the coach, she said, this week has been the best week of diabetes in my life. Now for somebody like Michelle, she's probably not gonna need that many calls. The coach really was just validating her own decisions. But if she does need it, they'll be there for help. Now everybody's not like Michelle. You talk about Jack. Jack is probably one of the more less plugged in, like Laurel was talking about. He was excited to do the study, but really wasn't making any changes himself. He was wearing the device, that's about it. And then in one of the calls, the coach was really trying to get information out of Jack and said, your numbers in the morning are always going up between 9 a.m. and 12 p.m. What's going on? He said, well, I work, and every day at 9 a.m., I have a break, and I love apples. And I also eat a piece of bread every day. She says, oh, well, okay, apple, that's good, but when you eat sugar and sugar, or carbs and carbs, your numbers are gonna go up probably. So what I want you to do is something a little different. Eat a smaller apple. And instead of bread, eat some peanut butter for some protein and fat to balance it out. And see what happens. Look at your data now, after 9 a.m., and see, do I go as high with this change? If you don't, great, this is something that could work. But if you do go out of range again, okay, don't worry about it, we'll figure out something else. For somebody like Jack, there's these more hand-holding. There's a lot more calls that'll probably have to happen. But that's okay, that's the point here is the personalized approach that can work for anybody, no matter what age they are, how tech-savvy they are, how plugged in or plugged out they are, where they live. The Geek Squad idea is working, but we don't want to stop here just at a clinical trial. We want this to work for the masses, and what that'll take is a commercial entity to take it on, to bring it out there. But to do that, we need to show that it can scale. So what we're doing now is we're planning a larger study that'll happen probably early next year. In the pilot, we had 35 people. In the larger study, we'll have 200 to 300. In the pilot, it was one state, Wisconsin. And the bigger study will be 5+ states across the United States. Really show it can work everywhere. We're also going to add some additional services. We're going to automate the decision support for titrations, have algorithms to actually help the coach give the advice to the participant. Mental health is also a very big issue in the United States. And people with chronic diseases like type 1 that are higher risk for that. So we're going to have mental health support for those who need it. As I said, the Geek Squad idea, this personalized approach works. Combination of the coaching, the coach plus the CGM data. And now we just have to see if it scales. I think this quote best kind of shows what this study's been doing. There's Joe, a study participant, who said, "I've never had the idea of just someone focusing on me." And this is, the type 1 diabetes program in the last 10 years has always been about this. How do we improve the lives of people living with type 1? And the CGM is just one example that we've done this. Years ago, we knew CGM had promised, but the devices weren't good enough. So, as Denise was talked about, we invested in Dexcom, which is the gold standard in the field. We have good devices now, but many people don't know about them. So we have the awareness campaign that Laurel's leading to make sure that knowing about CGM is not a limiting factor, that you know about it and then you make a choice. But we also know that for many people, it's not going to be just about knowing it. They need some help. And so we have the Geek Squad, the personal hands-on approach to diabetes care. Improving lives, is something that I think all the programs really focus on. And we have great projects, just like rural healthcare showed earlier. But without all the departments doing what they do, we wouldn't be able to execute that mission. So thank you.